Hey, this is Joey talking again about senior care issues. But this week we're going to talk about home care versus home health. There's a big confusion out there amongst people about they think that it's all the same. Well, it's not. If you have Medicare, guess what? It pays for home health. It doesn't pay for non-medical home care, unfortunately. One day it might. But for right now, let's talk a little bit about the differences between the two. You've got Medicare home health, skilled home health it's called, home health care. Then you've got us, we're called home care sometimes, non-medical, personal care services. So there's different names, but the confusion is most people don't even realize what the difference is because they don't care. They don't need it. It never comes up until it comes time to their family needs help. They don't even know where to go. But just for clarification's sake, there are differences, big differences. Medicare home health requires a physician order. It has nurses, therapists. All this is billed to Medicare. You get a certain amount of time, a 60-day period. Those can be recerted, but typically it's not an ongoing service. It's more of an acute thing. You get in, they get out. They might make a visit 1 to 4 times a week, maybe more in certain situations. They have a care plan. They try to get you to meet your goals within a short amount of time, and they discharge you. Because Medicare don't want to pay for anything in the long term. On the non-medical, the personal care, home care side, which I do, it's something that's determined by you or the family. You determine when you want to start, how much you want to do, because you're the payer source typically, you or long-term care insurance or VA. So you don't require a physician order. You don't have nurses and therapists. What you have are attendants or aides that help you with the things like everything from cooking to cleaning to personal care to bathing, dressing, laundry, running errands, all the things that a regular family member would do, the things that keep you at home and keep you independent. Companionship, that's a huge one. So when you're looking at the two, you're saying, well, Medicare is what you always hear about because it's easy. You don't have to pay for it. The government pays for it. It's an entitlement. But on our side, you have to pay for it. But guess what? Most people need my service, the ADLs, the personal care, the companionship things, more than they need skilled care. And they need it for a longer period of time. It's more preventative in nature. And in the long term, you can stay at home using it more so than you can with skilled care. So any of these questions like this, if you have any, just call us, 903-533-1300 or www.homeaidcaregivers.com. We'd be glad to answer questions for you, see if we can help you.